Did you know that one of the most important physiological tests that has been identified the past 15 years is something called the cortisol awakening response? What this response involves is that the minute you open your eyes, your cortisol levels should go up 50 to 150% and then come back down. And if this happens properly, that's a normal response. Now, this is usually measured with a cortisol test where a person collects saliva the minute they open their eyes and then they collect it within the first 30 minutes. They can measure if these levels actually go up from baseline from opening your eyes and then eventually go down. Now, this test has had hundreds of research papers published in the past 15 years. There's been systematic reviews, meta-analysis, and they found that when people have abnormal cortisol awakening responses, that they're at very high risk for having mood disorders, depression, various types of neuropsychiatric imbalances. They're also found to have imbalances in properly using their energy throughout the day, hard time recovering from workouts, hard time using their energy efficiently throughout the day. And these mechanisms are really important and things that we typically see in a clinical practice all the time. Now, when you look at the cortisol awakening response, the key thing about it is that it's not an adrenal gland functional test, that it's really a test that really involves the entire neuroendocrine response. So the minute you open your eyes and light hits your optic tract, you're actually firing pathways into your pineal system, and then your pineal system fires up to the suprachiasmatic nucleus in the hypothalamus, and then there's projections to autonomic centers that really control our sympathetic and parasympathetic outflow. And then we also have integration areas of your brain called the medial temporal lobe, where we control circadian rhythms. So this cortisol awakening response test is really a physiological test for efficiency of the neuroendocrine system. And it's surprising how many people have dysfunction in this cortisol awakening response. Now, once you identify this, simply taking nutraceuticals, support adrenal glands are not going to do much at all. The key thing with these imbalances is that you have to reestablish that cortisol awakening response. And simple things like the minute you wake up, within that first 5-10 minutes, doing a 5 to 7 minute high intensity workout, or doing dawn light stimulation in an alarm clock to slowly start to wake a person up, or ways that you can reestablish this. And this is very important for blood sugar stability, healthy adrenal function, and this whole integration of the neuroendocrine loop. We're going to be talking a lot about the cortisol awakening response, sharing with you some of the research, making sure you understand how to run the proper labs to identify imbalances in them, and then a detailed approach to really how to reestablish those responses in your patients that are really suffering from various types of mood disorders, energy issues, sleep problems, and so forth. Many times you really have to reestablish this neuroendocrine response. Those are going to be all taught at the Kharrazian Institute course, Diabetes and Dysglycemia, Clinical Strategies and Treatment Applications, and I hope you can attend the course. Thank you.